Good evening and welcome to I'm Chris Parnell.
Reporting from Moscow.
Tbilisi. Times Square.
May your dreams be your only boundaries in life.
Welcome to Let's Talk Money. My name is Harvey Cook and I thank you for turning in to Let's Talk Money today. On this program we talk a great deal about physical health, and today we're going to discuss our physical health. With rising health care costs, our physical health can have a significant impact on our finances as well. Joining us today to share his insight into the healthcare industry as well as our personal health, we are honored to have Dr. David Stern, who's Executive Dean of the University of Tennessee's College of Medicine and the University of Tennessee Health Science Center. So without further ado, let's talk money. Welcome, Dr. Stern.
How are you?
I'm good. It's good to have you. Tell us a little bit about your background and what inspired you to be a doctor.
So my path to medicine and my path to Memphis is like many, not exactly straight. Many curves and unexpected things. When I was a little boy, I was always someone that had a laboratory in my basement. And I was always interested in chemistry. And of course, most of the experiments resulted in things that my mother and father didn't think smelled so well. But nonetheless, that was a start in science. The other thing I was interested in was the clarinet. And I was quite a serious clarinetist. So when I was ready to go to college, I had two considerations: where I could be closest to New York and continue to pursue my dream to be a clarinetist, and where there would be a fine program nearby for academics. And I went to college in New Haven so I could commute back and forth to New York, and I was a chemistry major because that was really what my interest was at that time. And during the course of going to college, I decided I really wanted to be a professional clarinetist. And when I finally got a full-time job, and halfway through the fourth year and I was ready to go and take that job, my father said, "I really want my son the physician, not my son the musician." And that was many years ago. I graduated high school in 1969, so you can calculate how old I am. But at that point, I was quite interested in what he said. And when I graduated from college in 1973, I decided I would take his advice. So I took an extra year to take some of the courses for medical school, and then I went off to medical school. And that was very fortunate for me because my to-be wife, we married 2 years into medical school, was in my class, so I was lucky. And she was a philosophy major from the University of Chicago. So we both took an unusual route, one in philosophy and one in clarinet. But it was a medical school, I guess, that took unusual people. We went for 4 years to school in Boston, and then after that, we moved to New York, where I did residency in internal medicine at Columbia, and she became an ophthalmologist and was at Manhattan Eye, Ear, and Throat Hospital. During the time at Columbia is when I realized that what really intrigued me the most was understanding the basis for the things that we saw in clinic, the basis of health and the basis of the opposite of health, which is disease or pathophysiologic disorders, as we call them. And at that time, I turned very much to research. So after I finished training in internal medicine and then a year in hematology, I went into the laboratory and studied blood vessels for many years, probably about 25 years. And most of my patients at that time had forelegs. And four-legged creatures are very interesting in some ways, but in other ways they don't exactly reproduce what we want the most, which are various treatments that work, of course, in two-legged creatures like us. Having said that, a path for an investigator is a very interesting and intriguing thing. And one of the greatest strengths America has is its research infrastructure that creates engineers, it creates doctors interested in innovation, it creates investigators of all stripes, and it's a wonderful thing, and America does lead the world in that and still does, and a pipeline of new people going into that is essential. At Columbia, I ran a Center for Vascular and Lung Pathobiology, and as that got bigger and bigger, I began to see what I enjoyed was growing programs. And so at that point, I decided maybe I'd like to run a medical center instead of just running the research enterprise. And I first went to Georgia, and then after that I was 5 years the dean and vice president for health affairs in Cincinnati. And then I ended up, of all places, here in Memphis, where I've been for about 4.5 years. And again, my passion here is to make the medical school very much a part of the fabric of the healthcare environment that we have here by participating in every aspect of healthcare life that we have here. And as we progress with this discussion, I'll tell you what I view as our sort of central principles and how I'm trying to guide the school.
Great. So you've been an administrator, a physician, a scientist. Do you prefer one over the other? How do you view that?
Well, medicine, one of the nice things about it is there's every kind of career for someone that's in medicine. And that goes not just for doctors, but of course for nurses and many others as well, because medicine is a team sport, as everyone knows at this point. Researchers have a very important role, because if you think of many of the treatments that we use today, they didn't exist when I graduated from medical school, which was in 1978. So really research is a very important basis for what we do. For example, monoclonal antibodies are relatively new, and they're a very important mainstay of therapy now in a number of disorders. So research is essential. Clinical care, obviously, is where we deliver care that helps patients, and that is absolutely the bottom line, patient-centered care. On the other hand, administration is trying to put the pieces together in a few ways, putting together teams of people to work together, but it's also guiding things in a way that really takes the philosophy of the institution and makes sure that that comes across in the product we deliver, whether it's healthcare, whether it's research, or whether it's the educational missions. Because the real power of a medical school is putting together those three missions: the educational mission, the research mission, and the clinical mission. If you separate them, a clinical mission by itself is a community hospital. That's an important thing, but it's different than a medical school. If one only does research, that's a research institute. Again, that's different than a medical school. An educational enterprise is equally important, but it's something different than a medical school. So an academic medical center puts those three things together and tries to make those three coming together to deliver a product which is a result from all three of them.
I suspect we probably have some students that will watch this show and some students that are producing this show. Have the standards for admission to medical school, have they changed over the years? Has it gotten harder? Has it gotten easier?
So in general, it's gotten harder to get into medical school if one looks at the grade point averages and the various tests that one has to take. And there's a kind of standing joke among doctors, especially of my age, which is that if we had to reapply with today's standards, maybe none of us would have passed those standards. I don't know about that, but what I do know is that really the key indices for being a doctor, being able to deliver compassionate care, being available when patients need one, being very much up on the literature, giving evidence-based care, all the things that make a physician, that make a patient comfortable and cared for in the best way, we don't know how to assess that exactly. So it's a work in progress, figuring out what are the characteristics of a medical school applicant that will make a first-rate doctor. But in terms of just the absolute standard, yes, they're going up, but that isn't, we can't say that that's what really makes the kind of doctor that makes us all comfortable when we go to see a physician.
We're going to take a quick break, and when we come back, we'll continue our discussion. So why don't we get right in?
Do your stuff.
Okay, people, you know the drill. Canned foods only, guys.
Sometimes you gotta live what you believe, open your arms, 'cause that's where it starts. Right here with you and with me. I know well
pass it on.
A little help from up above.
A message from the Foundation for a Better Life.
There's a me no one knows, waiting to be set free.
So what's the empty suitcase for?
The grand prize trophy.
I was born to be somebody.
Welcome back to Let's Talk Money. If you are just tuning in, I'm Harvey Cook, and today we have been talking with Dr. David Stern, who's the Executive Dean of the University of Tennessee's College of Medicine and the University of Tennessee Health Science Center, as he shares his valuable insights into the healthcare industry, the medical profession, and our personal health. Welcome back, Dr. Stern. I wanted to ask you, what is your vision for UT Health Science Center, and also how that vision plays into what's going on in our community?
So my vision applies to the College of Medicine. It's the largest but an important section of the University of Tennessee Health Science Center. And I think the important thing is to have an impact on the community in a way that one is very integral in the healthcare environment or the health and well-being of the community. That includes much more than educating doctors. I guess many people might not know that we have about 700 full-time and 1,200 part-time doctors that are associated with the school, so it's a tremendous workforce. Medical school is actually very different than other components of a university. A law school doesn't run a large law practice. A musical conservatory does not run a large symphony orchestra. A medical school, though, does have an integral role in the health and well-being of the community, and I think it's important that it realizes it. So starting with that, let me talk about what my goals are for the school, or the vision. And the first is to address unmet medical needs in the greater Memphis area through the creation of centers of excellence that achieve national prominence. When one wants a doctor because you have a problem, you don't want the best doctor in Memphis, you want the best doctor, period. That's the kind of person I would seek to recruit in areas where we have an unmet medical need. The second is medical schools have to be concerned, academic medical centers, with caring for vulnerable populations, the very young, the very old, veterans, people that are underserved in various ways. That's just what our job is. Health disparities is another very important thing. Ameliorating health disparities is something medical schools at this point in academic medical centers study, but have to more seek solutions to what those disparities are. And finally, for me, is embracing the community. And let me tell you what I mean by that. When I went to medical school, and as I mentioned, we went in Boston, my wife and I together to Harvard, the medical school was much less concerned with embracing the community at that time, at least, than it was with creating a great educational, clinical, and research product, which it certainly did. I think it's a different time now, and for our medical school, I'm very interested in initiatives that really address problems of the greater Memphis area. I'll give you 3 examples, Harvey. First is if we take stroke, so that's a pathophysiologic disorder where the brain does not have enough blood flow. That can be because there's a hemorrhage into the brain, or it can be because there's a clot called a thrombotic stroke. Unfortunately, Memphis is in what we call the stroke belt. That means a high incidence of stroke in the Mid-South. And as is often the case in indices of poor health, Memphis is at the very top. It's the buckle of the stroke belt. And in fact, African American males in this community have a very high mortality and morbidity from stroke. So really, this is an important area to impact on the health of our community. So we've been able to secure funding from the Assisi Foundation, from a private donor, and another foundation which seeks to remain anonymous in excess of $3 million to create a mobile stroke unit. That's a stroke ambulance, you might call it, with a CT scanner and a doctor, and it's really like a moving emergency room. So it can go to the site of a stroke. I'm working with the emergency medical services, working with EMS here, go to the site of a stroke, diagnose the stroke, that it's the kind of stroke that should be treated with the tissue type plasminogen activator, and rapidly, right on the spot, administer the treatment. Why does it matter? Because time is brain in the stroke business. If one waits several hours to treat a stroke, the patient has severe disability. If you can do it within 20 minutes to an hour, the patient will walk out of the hospital. So again, this mobile stroke unit is an example of how we hope to change the face of stroke. We'll park it at a particular place that's 20 minutes from most of the population, because Memphis is perfect for this. We can reach the underserved population. We can reach Germantown and folks here. We can reach multiple sites. And our goal will be to answer the question, using this mobile stroke unit, can we change the face of stroke in this community? We'll educate students who will work together on the stroke van as well. So it has a research component, how does it work, an educational component, and of course, most importantly, a clinical component. So that's one example. A second example is a Center for Health in Justice-Involved Youth. And this center is headed by Dr. Alpha Stewart, a wonderful psychiatrist that's now on our faculty, that's also the Secretary of the American Psychiatric Association. And the goal here is working with Judge Dan Michael and with Stephen Bush and the juvenile defender, is to help the many children that come before the juvenile court, about 70% of whom have a mental health disorder. They're not criminals, but we know if we lock them up and don't attend to their mental health needs, that they go down a path that's not productive, and that can lead to a life in and out of the criminal justice system, as opposed to children that could have a normal pathway and lead to a productive life, which would be better for society and just would realize their potential, which is the most important thing. So again, in this center, the goal is to understand what is the kind of behaviors that the children show that leads to being involved in the criminal justice system. What's the best program that the judge, Justice Dan Michael, could assign them to, by understanding how can we help them the most. This again has research opportunities, clinical opportunities, and educational opportunities. The third example I'd like to give you is an addiction program, which we're just starting to develop. And in this program, Dr. Dan Sumrock will be the leader of this program. And addiction is something that crosses every line in our society, whether it's socioeconomic lines, gender lines, racial lines, and everything that you can think of. And it's an important problem because it not only is a pathophysiologic disorder, but it has a social stigma associated with it. So it's a harder thing to treat in essence. Having said that, there are treatments that can help people to deal with addictive disorders.
I'm going to stop you there for 1 minute. We're going to take a quick break, and then we'll come right back to this.
GHS-TV has a new website. You can now view any of our shows on our new media pages. Or check out the latest Wake Up Germantown or Red Devil postgame. As always, we're streaming live 24/7. Just visit ghstv.org today.
Thank you again for joining us on Let's Talk Money. Today we're honored to have Dr. David Stern, and we're going to get right back to what we were talking about before the break. You were on the third thing that your vision for the University of Tennessee Health Science Center.
So I was talking to you about how important community engagement is for us, and the three projects we'd mentioned, the mobile stroke unit, which I didn't mention, was headed by Dr. Andrei Alexandrov, who I'll mention shortly, our new chair of neurology. Also the Center for Health and Justice-Involved Youth, headed by Dr. Alpha Stewart. And finally, the Center for Addiction Science, headed by Dr. Dan Sumrock. And we were talking about the Center for Addiction Science, where what's essential for us is to have evidence-based treatments that are available to all people that have problems with addiction. We'd also like to have an integrated group of physicians that take care of patients that have pain problems, working alongside patients that have addiction problems, because very often the two are closely related as patients try to treat their pain and end up addicted. At the same time, there are opportunities for scientific inquiry. Trauma is an important vulnerability or susceptibility factor for addiction, and no one knows quite why. But episodes of trauma and neglect are something that's very important to study, to devise new treatments. So for us, an addiction center addresses an important problem in Tennessee that touches every segment of society, but again, has educational and research as well as clinical initiatives. So we're looking for things that tie together the three missions, something that makes the medical school able, at an academic medical center, able to make a strong contribution to the region. I'd also say that the kind of people I'm trying to draw are people from all over the United States to bring this kind of talent to Memphis. So the individual I mentioned who's chair of neurology, for example, that Dr. Andre Alexandrov, who came from the University of Alabama, Birmingham, was head of the stroke program and built it there. And when I recruited him, the last thing I did is I talked to his boss, who was the chair of neurology there, and he said to me, when my mother had a stroke, he was the only doctor I would have take care of her, and the best stroke doctor I can think of in the United States. That's the kind of person I want to provide for Memphis. Dr. Alexandrov is also an investigator in stroke who's interested in approaches to combining ultrasound with dissolving the blood clots, and is very active as a clinician in organizing a stroke service that has a clinic for transient ischemic attacks, that has a neurocritical care unit for patients that are unfortunately very ill, and he's the one leading the mobile stroke unit, which is essential, I hope, for preventing much of the damage. That's one of the kind of people we'd like to bring. I could mention another person, Dr. Benny Wexler, who we've recruited, who's our leading thoracic surgeon. He's chief of thoracic surgery. He operates particularly on patients with lung cancer and with esophageal disease. And he was a wonderful surgeon at the University of Pittsburgh Medical Center that we were able to steal from there. And he's created a wonderful service that didn't exist. It's based in the Methodist University Hospital, and brought Jennifer Sullivan, another talented physician from there. So again, it's drawing, Harvey, talent from all over the United States. Another example is our new chair of surgery, Dr. David Shibata. He was head of colorectal surgery at the Moffitt Cancer Center, now our chair of surgery, and he brings wonderful expertise in colorectal surgery, but also an insight into running a department of surgery that has clinical research and educational components, and putting those together. So we're looking to bring an unusual group of people that can advance the medical school for our students, but first to serve our community.
Well, these great doctors that you're attracting here, I assume that there's a lot of competition for that talent. How do you recruit that level of talent to Memphis, the University of Tennessee?
So the secret for recruiting people here is we look for people that want to have an impact in this setting. There are people that are hungry and want to change the profile of stroke, the profile of renal failure, the profile of heart failure, the profile of lung cancer in our community. So each of these people, what motivates them is an ability to make a difference, whether it's infant mortality and it crosses the life cycle to various diseases associated with aging and other processes. So what the folks say, and the example is always Benny Wexler. As I said to Benny when I recruited him, the lung surgeon, I said there should be lung cancer in Memphis, BB and AB, before Benny and after Benny. And he has a very concerted program that runs from smoking cessation to early detection to various surgical means to help people, and the goal is to impact on the statistics for lung cancer, which are very dismal in this community, especially in the underserved African American inner city. And people that want to have an impact on that are those that I seek out. I think that Memphis is a wonderful city to live in, but it's hard to recruit to. Many people are looking for an ocean that they can see. I happen to live in the old Rivermont Hotel, and I take them to my apartment and show them the Mississippi and ask them if that's enough water for them. And some say yes and some say no, but everyone agrees it's not an ocean. Right. They ask, some want mountains. I can't offer that either. But what we can offer is an inner city population, which is really where someone can make a difference, and make a difference, I feel, in an incubator that the whole country and the world is watching. And those are the kind of people that I look for, tirelessly trying to impact on that, Harvey.
Well, there's been a lot of talk, certainly in the recent past, about the high cost of health care. Is there any advice that you can give to our listeners about obtaining health care if they don't think that they can afford it? I see all the time, I meet people who need treatment, and they say, I just can't afford it. Is there, and we only have a minute to go, but is there anything that you might say about that?
Well, what I would say is at this point, especially in Tennessee, where the Accountable Care Act has not been adopted and we don't have Medicaid expansion, that there still is a lot of care, uncompensated so-called, just meaning that there's not a payer source, that is given out in the community, whether at federally qualified health centers, at some of the clinical operations that we participate in via Methodist or at Le Bonheur. So I think in Memphis there are opportunities to pursue care, and I would encourage everyone to look at that carefully. On the other hand, for the physicians, we encourage the physicians that service is a very important part of what we do, and we have to serve everybody.
Sure. Thank you, Dr. Stern. On behalf of all Memphians, I'd like to thank you for what you're doing for our community, because you're going to make a big difference. Appreciate that. Once again, we want to thank our guest, Dr. David Stern, for joining us. We hope this show provided valuable insight into the keys to success, both professionally and personally, and we encourage each of you in your future endeavors. We hope you will join us again next month on Let's Talk Money.